My family comes from India, and it's really different there. The public health system, where it does exist, is massively underfunded, and for those who can afford it, they go private. So what about the people who can't afford it? My grandfather was a surgeon, and he actually provided free healthcare for poor people in a charity clinic for more than 30 years before he died. And I know what the value of free healthcare is, because I've seen really poor Indian villagers walk thousands of kilometres just to come and be treated at that clinic. Now, as a paediatrician here in the UK, I think about the patients that I wouldn't have been able to treat had it not been for the NHS. But I grew up wanting to be a doctor, partly because I was excited about working in the NHS. The fact that there is a health system that kind of puts aside differences in race, gender and class to provide universal free healthcare for all is incredible. Now, as a paediatrician here in the UK, I think about the patients that I wouldn't have been able to treat had it not been for the NHS. So what I'm worried about with the attacks on the NHS is that we're going to lose our free healthcare system and that I'm not going to be able to do my job properly. I'm worried about parents who are going to have to face really difficult decisions about whether they're going to pay for feeding and clothing their children, or whether they're going to have to pay for healthcare costs. And this is not something that's like a scare story. This is happening every day already in the US, where they have a private healthcare system. That's why we have to fight to keep the NHS, and that's why, I'm doing everything I can to keep the NHS, because I still want to be excited about going to work in the NHS in years to come.